I'm going to be demonstrating the fundamentals of central line cap change and central line dressing change. For central line cap change, you'll have clean hands and wash your hands or alcohol them. You'll put on clean gloves. You'll gather your 3 caps. I'm going to do 1. You'll have a saline syringe for each cap because you're going to want to check for blood return and then do a complete flush on each line. And you'll have an alcohol prep pad. So you start with, you'll have your lines primed. So I'm going to prime the cap. Being careful not to contaminate the end. And prime the cap completely. You'll have your alcohol cap ready. With the clamp on, you're going to remove the cap. You're going to clean the hub for 15 seconds, just as you would any hub before you attached anything. So after 15 seconds, you'll let the end dry completely, and then you'll attach your new cap. Release your clamp. Check for blood return, and once that's confirmed, then you'll flush completely using a stop-start motion. And you'll repeat on the subsequent 2 other caps. For central line dressing change, you'll remove the top. Again, you're going to have clean hands and you're going to don clean gloves. You'll have your mask on. And you're going to remove the soil dressing. So you want to take care to secure the central line so as not to pull it out as you remove the soil dressing and the soiled bio patch. You'll discard those along with your clean gloves. And then you'll don your sterile gloves. Of course, they never go on as quickly as you want them to. So after you've donned your sterile gloves, you will take your alcohol swab and you'll clean the site, clean to dirty, in to out, removing any organic material, dried blood, whatnot. Try and clean under there as best you can. Discard that. You don't need to let that dry because you're going to clean it next with your chlorhexidine and alcohol fret pad. And with this pad, you don't need to clean in to out. You can clean in any direction. And you want to use some friction to clean the site well. And you'll clean under there as best you can, and you'll clean the tubing that will be underneath the dressing. In a good wide area, whatever you think is going to be under the dressing. So you clean this for 30 seconds, and then you let it dry completely. After it's dried completely, you'll use your skin prep pad, and you'll apply this to the area where the dressing will be. And again, you'll let that dry completely. When that's dry, you'll take your bio patch, and you apply your bio patch over the insertion site and around the catheter itself. It's not going to go completely underneath it because they're usually sutured down. You'll take your sterile dressing and apply that, keeping the insertion site as much in the center of the dressing as you can. Apply that. Remove the border. Of course, if this was completely dry, it would stick really well. You'll remove this, making sure the edges are down. Then you'll date and time your label, put your initials, and apply this to your dressing.